Hi, I'm Dr. P.K. Talwar, cosmetic surgeon, New Delhi, and I'm practicing cosmetic surgery for more than 30 years now. Previously, I was attached to Apollo and Max hospitals, and now I'm running my own cosmetic laser surgery center at Greater Kailash Part 1, New Delhi. One of our patients have inquired that how many sittings of fat injection required for breast augmentation, or how many maximum sittings will it be required. So actually, I have mentioned in previous videos also that whenever we inject fat in breast, so usually 25 to 30% fat may get absorbed, and patient has to be ready for a touch-up procedure after some time, maybe after 6 months or a year, so that get a good result. So I would say that average 2 sittings may be required. Rarely third sitting if fat absorption because of some reason is more. But for all practical purposes, I tell them 2 sittings touch-up, because touch-up procedure may be required in 30% of the patient. And sometimes we have seen that whatever we have injected fat, it stays there almost completely. And rarely it may happen that whatever fat you have injected may get absorbed. I have seen couple of cases that way also. But this, for all practical purposes, I will say, but some patient ask me or they come to me for consultation, I tell them we are going to inject fat and 30% may get absorbed, and you should be ready for a touch-up procedure in case it is required. So and when they inquire, I also tell them, we are second sitting, if it is required, if it gets absorbed, you have to be ready for that. Don't blame the doctor, because it's a scientific fact. So average 2 sittings, and rarely maybe third sitting may be required if patient wants more, or there was some problem, maybe like in first sitting if the 100% fat gets absorbed because of one reason or another, so then third sitting, but usually average 2 sittings may be required. But many times we see that patient after one sitting is also very happy and the fat stays. So you cannot exactly predict how many sittings. I tell all my patients that 2 sittings touch-up procedure may be required, and you be ready for that. So that is how I will answer your question also, because there are some things which we cannot guarantee 100%. We cannot imagine the result 100%. We can't predict them, but it is by going by the experience we can just suggest to them that this is a likelihood and this is how many sittings they may require. So I hope I'm clear in what I'm trying to convey to you, and you understand the pros and cons, because fat is not a material like implant that which 100% stays. It might get absorbed to a certain extent, and be ready for that. So with that, I hope I have answered your question, but still if you feel that you have got few more queries and you would like to ask, so please feel free to call us or contact my team, and we will get back to you and answer all your queries as usual. And if you like the video, please don't forget to subscribe it. Thank you very much.